To answer the question, which of the following does not limit range of motion, we first need to consider the various factors that can limit the range of motion ROM in the human body. The range of motion refers to the distance and direction a joint can move, and it is influenced by several elements, including anatomical structures, injury, and physiological conditions. The factors that typically limit ROM include joint structure and anatomy. The way a joint is structured can significantly impact its ROM. For example, ball and socket joints like the shoulder have a large range of motion compared to hinge joints like the elbow. The shape and alignment of the bones, ligaments, and tendons around a joint are key factors. If the anatomical structure is abnormal or malformed, such as congenital conditions, it can reduce ROM. Soft tissue resistance, muscles, tendons, and ligaments surrounding a joint play a critical role in ROM. Tightness or stiffness in muscles and connective tissues often limits movement. Conditions like muscle spasms, strains, or tightness due to overuse or lack of flexibility can reduce the ROM at a joint. A lack of flexibility is often a result of inadequate stretching or prolonged inactivity. Joint pathology and injury. Joint injuries, such as sprains, strains, fractures, or arthritis, can severely reduce ROM. Inflammatory conditions like rheumatoid arthritis can cause joint swelling and stiffness, which limits the movement. Joint degeneration, often due to osteoarthritis, can result in bone-on-bone contact that limits motion. Injuries also lead to scarring of tissues, further reducing flexibility and range. Age. As people age, the range of motion tends to decrease. The natural aging process results in the stiffening of the joints, cartilage wear, and a loss of elasticity in the muscles and tendons. These age-related changes can limit flexibility and movement capacity, leading to a reduction in ROM. Pain, particularly chronic pain from conditions such as osteoarthritis or past injuries, can limit ROM. Pain often causes people to restrict their movement instinctively to avoid discomfort, thus limiting the joint's natural range. Now, let's consider the factors that do not limit ROM. Hydration. Proper hydration supports muscle function and the lubrication of joints, but it does not directly limit ROM. In fact, adequate hydration can help maintain muscle elasticity and joint health. Dehydration may contribute to muscle cramps or stiffness, but it does not inherently limit the joint's range of motion. Nutrition. While nutrition is essential for overall health, it does not directly limit ROM. A balanced diet ensures that the body has the necessary nutrients for muscle and joint health, but it is not a direct factor in reducing the joint's range of motion unless there is a severe deficiency, such as a lack of calcium leading to bone health problems.